what if I tell you that almost every sensation from your face is traveling through one remarkable system, and that's your trigeminal system? Think of it as a brain's gateway to your facial sensations. What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe. Let's talk about the trigeminal system. And the trigeminal system is the primary sensory system of the face. Primary sensory system of the face means it's dealing with taking information from the face. What kind of information? The sense of touch, pain, temperature, and the proprioception. But it's also dealing with controlling the muscles of mastication, the chewing muscles, alongside other muscles that are derived from the first pharyngeal arch. This is to say the trigeminal system is made up of the trigeminal nerve, the one which is getting the information from the face and also controlling the muscles of the first pharyngeal arch, the trigeminal ganglion, and the trigeminal nuclei that are found within the brainstem. Then why don't we remind ourselves about the trigeminal nerve? Well, the trigeminal nerve is cranial nerve number 5, and it's called trigeminal, tri for 3 branches of the trigeminal nerve. These are the 3 branches, and ideally the word trigeminal means bone 3 together. This is to say the 3 branches of the trigeminal nerve, they are like triplet brothers, like they were born together. These are the 3 branches. So this is the ophthalmic branch of trigeminal nerve, this is maxillary branch, and this is mandibular branch of the trigeminal nerve. The trigeminal nerve is a mixed nerve. That means it has got both sensory fibers and motor fibers traveling through the same nerve. But if you want to be specific, the first 2 branches of the trigeminal nerve, they are purely sensory nerves. The ophthalmic nerve and the maxillary nerve, they are purely sensory nerves, but the mandibular branch is a mixed nerve. That means it's got both sensory fibers and motor fibers. It is motor to the muscles of the first pharyngeal arch. So that's your ophthalmic nerve, and it's exiting the cranial cavity through the superior orbital fissure, and that's your maxillary nerve, which is exiting through the foramen rotundum, the rounded foramen, and your mandibular nerve is exiting the cranial cavity through the foramen ovale, the oval foramen. And as I've told you, mandibular nerve is a mixed nerve. It has got both sensory fibers and motor fibers within the same nerve, but the first 2 branches of the trigeminal nerve, they are purely sensory. Then I find it extremely important to remind ourselves about types of sensation. Sensation can be divided into 2 major groups: somatic sensation and the spatial sensation. And the somatic sensation is a conscious perception of temperature, touch, pain, proprioception, and vibration, whereas the spatial sensation is the sensation of vision, smell, taste, hearing, and balance. Remember those spatial sense organs? Yes, these are the spatial sense organs. But the trigeminal system is dealing with the somatic sensation. And if you want to be specific, is the general somatic sensation. Let's forget about the spatial sensation. We're going to deal with somatic sensation in this discussion. Okay, so let's discuss about the territories of the trigeminal system, the regions that are receiving innervation from the trigeminal nerve and the trigeminal system in general. These are the regions that are receiving innervation from the trigeminal nerve and the trigeminal system. And as I've told you, the trigeminal system is a mixed system. It has got 2 components. It has got a sensory component and a motor component. The sensory component is taking information from the face, the bigger part of the head, inside of the nose, the nasal sinuses, the paranasal sinuses, inside of the mouth, and the anterior 2/3 of the tongue. But be careful with the anterior 2/3 of the tongue, because it's taking only general sensation. As I've told you, the trigeminal system is only general somatic system. It does not involve the spatial sensation. That is to say, the anterior 2/3 of the tongue does not receive the spatial sensation from the trigeminal system. And if you guys remember, the anterior 2/3 of the tongue is receiving information from the chorda tympani, which is a branch of the facial nerve. And the general sensation is coming by the way of the lingual nerve, and the lingual nerve is a part of the mandibular branch of trigeminal nerve. So this is to say it is coming from the trigeminal nerve system. And now it is safe to say that the anterior 2/3 of the tongue is receiving general somatic innervation from the trigeminal system, but also the anterior 2/3 of the dura mater, or the supratentorial dura mater, is also receiving innervation from the trigeminal nerve. Remember, the dura mater can be divided into 2 parts: the anterior 2/3 and the posterior 1/3, or the supratentorial dura mater and the infratentorial, above the tentorium cerebelli and below the tentorium cerebelli. So above the tentorial cerebelli, the dura mater is receiving innervation from the branches of the trigeminal nerve to the trigeminal system, but the subtentorial dura mater is receiving innervation through the vagus nerve to the trigeminal system. We're going to see later that the vagus nerve is connected to the trigeminal nuclei to the brainstem, and it is safe now to say the subtentorial compartment is also, the subtentorial dura mater is also carrying the information to the trigeminal system, but is carrying this information by the way of the vagus nerve, which is the cranial nerve number 10. The supratentorial compartment, the supratentorial dura mater is carrying this information through the trigeminal nerve to the trigeminal nuclei, directly through the trigeminal nerve, but the subtentorial by the way of the vagus nerve, which is cranial nerve number 10. And then the motor component, we have said we have the nerves that are controlling the muscles of mastications. These are the masseter, temporalis, medial and lateral pterygoid muscles, but we also have other muscles that are derived from the first pharyngeal arch. These are the tensor palatine, the tensor palatine anterior belly of the digastric muscle alongside the mylohyoid muscles. And then the trigeminal nerve is coming off the brainstem at the ventrolateral surface of the pons, and this is the only nerve which is coming from the pons proper. Remember, we said the other three nerves, they are coming at the junction of pons and medulla, the pontomedullary junction, and it's the only the trigeminal nerve which is coming from the pons proper. Once comes from there, it goes to the Meckel's cave, and inside there it forms a ganglion which is called the trigeminal ganglion, also known as the semilunar ganglion or Gasserian ganglion. This is the semilunar ganglion, also known as Gasserian ganglion, also known as the trigeminal ganglion. One thing to bear in mind is that the trigeminal ganglion is a sensory ganglion. It is not motor, it is not autonomic, it is not parasympathetic, but it's a sensory ganglion. And what's a ganglion, by the way? Ganglion is collection of neuronal cell bodies outside the central nervous system. So the trigeminal ganglion is a collection of neuronal cell bodies of the sensory fibers of the branches of the trigeminal nerve. There is no any motor branch, there is no any autonomic, parasympathetic or sympathetic within the trigeminal ganglion. And then from the trigeminal ganglion, the trigeminal nerve now forms the three branches, the three bone branches, and these are the ophthalmic branch, maxillary branch, and mandibular branch. Wait, isn't the trigeminal ganglion the same as trigeminal nucleus? What a ganglion is, what's a nucleus? A ganglion is collection of neuronal cell bodies outside the central nervous system, and the nucleus is a collection of neuronal cell bodies within the central nervous system. So this is the trigeminal ganglion, and within the central nervous system, within the brainstem now, we have the trigeminal nucleus. So the trigeminal nuclei, they are found within the brainstem, whereas the trigeminal ganglion, the trigeminal ganglion is found outside the central nervous system. But another important difference between the two is that the trigeminal ganglion is containing the neuronal cell bodies of the first order neurons. The first order neurons, or the primary sensory neurons, they have their cell bodies within the trigeminal ganglion, whereas the secondary order neurons, or the second order neurons, or the secondary sensory neurons, they have their cell bodies within the brainstem, and these are called the trigeminal nuclei. We have 4 trigeminal nuclei, and one of them is motor and the other 3 are sensory. Remember, we've said the trigeminal system is a mixed system, has got motor component and the sensory component, and within the brainstem we have one nucleus which is devoted for dealing with the motor part of the trigeminal system, and the other 3 nuclei, they are dealing with the sensory information, processing of the sensory information which is coming through by the way of this trigeminal system. Yes, so this is the motor part of the trigeminal nucleus and of the trigeminal system, and this is the nucleus of trigeminal nerve, which is called the motor nucleus of 5, or the motor nucleus of the trigeminal nerve. And then we have 3 trigeminal sensory nuclei. The 3 trigeminal sensory nuclei, they are forming the trigeminal sensory nuclear complex. So if you ask in an exam what is the trigeminal sensory nuclear complex, and that is the combination of these 3 nuclei. Number 1, the nucleus number 1 is called the mesencephalic nucleus. And as you can guess from the word, the mesencephaly means the midbrain. So this means this nucleus is present within the midbrain. but it's connected, of course. It's a trigeminal sensory nuclear complex. It's connected to other nuclei. And then we have the biggest nucleus, which is found within the pons, and it's called the chief or main sensory trigeminal nucleus. So the chief sensory trigeminal nucleus is found within the pons. Yes. Also, the other name of which is called the main sensory trigeminal nucleus. And the last part of the trigeminal sensory nuclear complex is extending from the medulla to the upper part of the cervical spinal cord. And this is to say that the whole trigeminal sensory nuclear complex is extending from the midbrain to the upper part of the cervical part of the spinal cord. And one more time, this trigeminal sensory nuclear complex is dealing with the general somatic sensation, no spatial, no motor, and also have a different motor nucleus which is controlling those muscles that are derived from the first pharyngeal arch. What are the inputs to the trigeminal sensory nuclear complex? Do we have motor here? No, we don't have motor, because motor has got its own nucleus. So the trigeminal sensory nuclear complex is dealing with general somatic sensation, no motor, no parasympathetic, no autonomic. Okay, so the main input to the trigeminal sensory nucleus is by the way of the trigeminal nerve. Yes, this is a trigeminal nerve forming the main input to the trigeminal sensory nuclear complex. And we remember that the trigeminal nerve is carrying information from the face, mouth, head, the anterior 2/3 of the tongue, the nose, inside of the nose, the paranasal sinuses, and the supratentorial matter. All this information is carried by the way of the trigeminal nerve to the trigeminal sensory nuclear complex. But we do also have input from other nerves. For example, the facial nerve, cranial number 7, is carrying information from the external ear and is projecting this information to the trigeminal sensory nuclear complex. This is the facial nerve, and this in the bluish here, the sensory branch of the facial nerve, and you can see part of it is coming to the trigeminal nuclear complex, and part of it is going to the facial nucleus. Next is the glossopharyngeal nerve, which is cranial nerve number 9, and the cranial nerve number 9 also has got some sensory branches that are going to enter the trigeminal sensory nuclear complex. And you can remember the Jacobson's nerve, which is a branch of the glossopharyngeal nerve, is taking information from the external ear. From the external ear, we have a Jacobson's nerve, which is a branch of the glossopharyngeal nerve, and this is the one that gains information from the external ear to the trigeminal sensory nuclear complex. But some other informations are coming from inside of the ear and the posterior third of the tongue. Remember, the posterior third of the tongue is receiving both general sensation and spatial sensation from the glossopharyngeal nerve, but trigeminal sensory nucleus is dealing with only general somatic sensation. So the general somatic sensation part of the glossopharyngeal nerve, which is coming from the posterior third of the tongue, is going to the trigeminal sensory nuclear complex, but that special sensation is going somewhere else. And lastly, also we have input from the vagus nerve to the trigeminal sensory nuclear complex, and of course from the external ear we have a nerve which is called the Arnold's nerve. Remember, the Arnold's nerve from the external ear is getting information to the trigeminal sensory nuclear complex. But I've told you about the infratentorial dura mater. The dura mater below the tentorium cerebelli is taking information by the way of the vagus nerve, but to the trigeminal sensory nuclear complex. This is the cranial nerve number 9, which is the vagus nerve, but you can see it enters, part of it enters the trigeminal sensory nuclear complex. Of course, other information by the way of cranial nerve number 9, number 10 is from the phalanx into the trigeminal sensory nuclear complex. Let's remind ourselves about this external. This is the external ear, and we've said part of the external ear is receiving information from the being innervated by sensory fibers of facial nerve, cranial nerve number 9, which is the glossopharyngeal nerve, and the cranial nerve number 10, which is the vagus nerve, that forming the part of the external ear. And of course, the bigger part of the face and head is receiving information by the way of the branches of the trigeminal nerve. This is why we say that the trigeminal nerve is the main input to the trigeminal sensory nuclear complex. So this is just a different view of this trigeminal sensory nuclear complex, and this is within the midbrain. So this one should be mesencephalic nucleus. This one is within the pons, so should be the chief trigeminal sensory nucleus, and this one is the spinal trigeminal nucleus. Something very important to notice is that each of these nuclei, they are responsible for different sensory modalities. Remember, we have pain, temperature, pressure, proprioception, and vibration, and each of these nucleus is assigned a specific sensory modality to deal with, specific sensory information to deal with. So we're going to discuss each of these nuclei and talking about the modalities that they are carrying in and their special features. Number one, let's start with the chief trigeminal nucleus of 5. This is the chief trigeminal nucleus of 5, and the sensory modalities which are carried by the chief trigeminal sensory nucleus is the fine touch and the dental pressure. So if at all you have information that is about the fine touch and the dental pressure, this information will be relayed within the chief trigeminal nucleus of 5. There you have a primary sensory neuron, which is also called the first order neuron. Is coming from the organ. It's going to synapse within the chief trigeminal nucleus of 5. I want to make something very clear here, that these primary sensory neurons, or the first order neurons, they make the first synapse within the nucleus. Within the nucleus. And what's a nucleus? A nucleus is collection of neuronal cell bodies within the central nervous system. So the trigeminal nucleus is collection of chief trigeminal nucleus is a collection of neuronal cell bodies within the central nervous system. But we also have the ganglion here, which is called the trigeminal ganglion or the semilunar ganglion. And the semilunar ganglion is collection of neuronal cell bodies outside the central nervous system. There you have the primary sensory neuron, which is also called the first order neuron. And the first order neuron is getting this information from the receptor to the nucleus. And I want to make something very, very clear here. That the first order neuron is getting this information from the receptor, but it's going to make the first synapse within the nucleus. What's the nucleus? Nucleus is collection of neuronal cell bodies within the central nervous system. Remember, we also have a ganglion here, but it is important to note that these neurons, the first order neurons, they do not make the first synapse within the ganglion. Within the ganglion, they have their cell bodies. Remember, ganglion is a collection of neuronal cell bodies outside the central nervous system. So the first order neurons, they have their cell bodies within the trigeminal ganglion, but the first synapse is going to happen within the nucleus. And for this case now, it's happening within the chief trigeminal nucleus of 5. What kind of information is carried within this chief trigeminal nucleus is the fine touch and dental pressure. And then from the nucleus of the chief trigeminal nucleus, we have the second order neurons, the secondary sensory neurons, and these are forming the trigeminal lemniscus. And then the trigeminal lemniscus is crossing over to the contralateral side, and then it ascends to the thalamus, and specifically to the ventral posterior medial nucleus of thalamus. And then from here, they are synapsing with the third order neurons or the tertiary sensory neurons. And these tertiary sensory neurons, that are carrying this information to the primary somatosensory cortex or primary somatosensory area, which is Brodmann number 3, 1, and 2. I'm repeating one more time. We have the sensory fibers, the primary sensory neurons that are carrying information from the receptors. They are taking this information to the nucleus. In the nucleus, they are synapsing with the second order neurons, and then the second order neurons, they are forming the so-called trigeminal lemniscus. They are crossing over to the contralateral side, and then they are sending to the contralateral side of the brainstem until they are reaching the thalamus. And within the thalamus, they are going to synapse with the third order neurons within the ventral posterior medial nucleus of the thalamus. And then the third order neurons, that are taking this information to the cerebral cortex, and to be specific, to the primary somatosensory area, which is Brodmann area number 3, 1, and 2. Next, let's talk about the spinal trigeminal nucleus of 5. This is the spinal trigeminal nucleus of 5, and the spinal trigeminal nucleus is dealing with pain, temperature, and crude touch. And if you guys remember, pain, temperature, and the crude touch were carried by the way of the anterolateral pathway in the spinal cord, if you remember. But from the face, this pain, temperature, and the crude touch, they are mediated through the spinal trigeminal nucleus. So we have the receptors here. Receptors taking this information to the first order neurons or the primary sensory neurons, and the primary sensory neurons are going to synapse to make the first synapse within the nucleus. Remember, not within the ganglion, but within the nucleus. Of course, within the ganglion, we have the collection of neuronal cell bodies of these neurons, but the first synapse is expected to happen within the nucleus. Now we're talking about the spinal nucleus of 5. They are synapsing with the second order neurons, and the second order neurons in the spinal trigeminal nucleus, they are called, or they are forming the so-called the trigeminal thalamic tract. The tract from the trigeminal nucleus to the thalamus, the trigeminal thalamic tract. But the trigeminal thalamic tract, remember, the second order neurons are the one that are forming the they are crossing over. So the second order neurons, the trigeminal thalamic tract, they are crossing over to the contralateral side of the brainstem, and then they are ascending through the contralateral part of the brainstem to the thalamus. Within the thalamus, same applies. They are going to form the they're going to form synapse with the third order neurons within the ventral posterior-medial nucleus of thalamus, and the third order neurons, they are taking this information to the primary somatosensory area, which is a Brodmann area number 3, 1, and 2. One more time, you have the primary sensory neuron, which is also called the first order neuron, which has got its cell bodies within the trigeminal ganglion, but it's going to form the first synapse within the trigeminal nucleus of 5, the spinal nucleus of 5, and it's forming synapse with the second order neurons, and the second order neurons are called the trigeminal thalamic tract, and these are crossing over to the contralateral side of the brainstem, and then they are ascending to the ventral posterior medial nucleus of thalamus, and then from here they are forming synapse with the third order neurons, and then from the third order neurons, this information, they are going to the primary somatosensory area or primary somatosensory cortex. Lastly, let's talk about the mesencephalic nucleus, and the mesencephalic nucleus is dealing with the proprioception from the muscles of mastication. We've already seen other sensory modalities taken care by the other two nuclei, but the mesencephalic nucleus is dealing with the proprioception from the muscles of mastication. And we have something very different from the other two nuclei that we already discussed, that the first order neuron in the mesencephalic nucleus, they do not have cell bodies within the trigeminal ganglion, but they're going to have the cell bodies within the central nervous system. Remember, for the past two cases, we have seen that the first order neurons, they have their cell bodies within the trigeminal ganglion. This is not true in the mesencephalic nucleus, because the first order neurons in the mesencephalic nucleus, they do not have any cell body within the ganglion, but they're going to have a cell body within the central nervous system. This is to say, the mesencephalic nucleus is actually formed by the first order neurons. Yeah, the collection of neuronal cell bodies of the first order neurons, they are going to form the mesencephalic nucleus. And also, the synapse does not happen here. Okay, because we only have one neuron, which is one cell bodies, which is the first order neurons, and then these neurons, the first order neurons, they are descending to the chief trigeminal nucleus, and they are going to synapse in the motor nucleus of 5. Note this difference, that you have the first order neuron, and the first order neuron does not have any ganglion, any cell body within the ganglion, and it's going to form its cell bodies within the central nervous system. And remember, collection of neuronal cell bodies within the central nervous system fits to be called the nucleus, and this is how the nucleus of 5 is formed. It is formed by the collection of neuronal cell bodies of the first order neurons, and then from here it does not synapse with the second order neurons as we have seen in the other two systems, but it descends to the nucleus, to the chief trigeminal nucleus, chief trigeminal sensory nucleus, and is going to synapse with the motor trigeminal nucleus. And then from here, these neurons, they are mediating the jaw-jerk reflexes. You know, when you hit, we're going to talk about jaw-jerk reflexes at some point, but this is how the mesencephalic nucleus and the tract is different from the other two systems, the chief trigeminal sensory nucleus, and also the spinal trigeminal nucleus of 5. Now let's talk about the motor nucleus of 5. The motor nucleus of 5 is located in the pons. It mediates the motor function of the trigeminal nerve. What are the motor function of the trigeminal nerve? This is a repetition. We have seen it controls these muscles, the muscles of first pharyngeal arch. But the motor nucleus of 5 is receiving information from the cerebral cortex by the way of the cortico-bulbar tract. Cortico from cortex, bulbar. So let's clarify something here one more time, that we have said the face is receiving sensory information, sensory innervation from the trigeminal nerve, and these are the branches of the trigeminal nerve. The upper part of the face is receiving innervation, sensory innervation from ophthalmic nerve, the middle part of the face by the maxillary nerve, and the lower part of the face by the V3, which is mandibular branch of the trigeminal nerve. But something very important to notice here is that the tip of the nose is innervated by V1 ophthalmic nerve, but the ally of the nose, they're receiving information from V2. This is very, very important. So if your patient has lost sensation from the ally of the nose, then you know the problem here is V2. But if the patient has lost the sensation from the tip of the nose, then the problem is V1. Same applies. The upper part of the lip, the upper lip is receiving information from V2, but the lower lip is receiving information from V1. So if the patient is feeling numbness in the upper lip, then you know the problem is V2. But if the patient is really, losing sensation from the lower lip, then the problem is V3. Of course, also the chin is innervated by the branches of V3, and this is very, very important to note. And this is how the face is receiving the information from the trigeminal system. Knowing this distribution is important because we're going to discuss something which is called the trigeminal neuralgia. And the trigeminal neuralgia is the chronic neuropathic pain disorder which is characterized by recurrent episodes of severe facial pain in the distributions of the trigeminal nerve. It's usually caused by compression of the trigeminal nerve near its root by an artery, commonly by an artery, and which artery? Which is called the superior cerebellar artery. Superior cerebellar artery can compress the trigeminal nerve near its root, and so it's causing the chronic neuropathic pain, recurrent pain in the face in the region that is supplied by the trigeminal nerve. So for example, if this part is affected here, then you know, okay, this upper part of the face is receiving innervation from the ophthalmic branch of the trigeminal nerve. So the part which is affected is the ophthalmic nerve. But also if you see the lower part of the face or the lower lip is affected, the patient is feeling chronic pain in the lower lip, then you know, okay, this is the region of mandibular distribution. So the problem here might be the compression near the fibers of the mandibular nerve. So this compression is causing focal demyelination. This is the one that results into pain associated with the trigeminal neuralgia. And this pain can be treated with carbamazepine among other medications. And they discuss the difference between the trigeminal ganglion and the trigeminal nuclei, and go and discuss also the trigeminal reminiscus vis-a-vis medial reminiscus. And I also want you to trace the pain sensation from the right cheek to the cerebral cortex. I want you to tell me like the first order neurons that are carried by here and here, and then they're going to which nucleus of the trigeminal nuclear sensory complex, and then from there what are the second order neurons, and the second order neurons, are they crossing the midline or are they saying the same side of the brainstem, and what are the neurons that are going to the thalamus, and then from the thalamus what are the neurons that are carrying this information to the primary somatosensory area, which is the Brodmann area number 3, 1, and 2. So in short, I've already given you the answer. I also want you to trace the fine touch sensation from the left upper lip to the cerebral cortex. I want you to tell me, out of the 3 branches of the trigeminal nerve, which one is carrying this information, from the right side or left side, and then which one is carrying this information to the trigeminal sensory nuclear complex, and to which nucleus specifically out of the 3 trigeminal sensory nuclei. Yeah, and then from there, where will be the second order neurons? Are they ascending within the same side or the contralateral side? And then what happens in the thalamus, and from the thalamus to the cerebral cortex, which part of the cerebral cortex, left or right? And also tell me which region of the cerebral cortex. You have so many functional regions of the cerebral cortex. And these are the kind of scenarios that you need to train yourself, because the questions in exam, they use this idea. So they are giving you a reverse order of this scenario, like they're telling you a patient is experiencing maybe pain on the blah 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 blah, and maybe where do you think the region will be along the path of this information, and then pain is carried by the spinal nucleus of 5, spinal trigeminal nucleus, and things like that, going to the ventral posterior medial nucleus of the thalamus and the stuffs. Alright, I have side-by-side table that shows the difference between the trigeminal ganglion and the trigeminal nucleus. We have already seen the cell bodies of the first order neurons are present in the trigeminal ganglion, except for the mesencephalic nucleus, and of course there is no synapse in the first order neurons. In the trigeminal, there is no synapse in the trigeminal ganglion, but there is a synapse in the trigeminal nuclei. and some other differences that are here, the information. And this is what I had for you today, and see you soon. Bye bye.